Good evening, everyone, and welcome to the Genius Junction quiz, which is being organized by the Greater Chandigarh chapter. Very warm welcome to you all from myself, Dr. Bharti, who is my co-host, and conference's international representative, Mr. Shiva. And like I was saying, this is a great platform for everybody to come forward, participate, update themselves, interact, and move on to the further levels of the quiz. There is also another limb which is being followed, wherein a quiz is conducted every month by the center. So different zones are conducting, and winners from that quiz at the central level, they go directly to the final quiz at Fertivision. They don't have to go through the zonal round. So I think the next one is slated for the 25th of October, which is also the day when we are going to have our journal club. So probably we'll have both things back to back like we had yesterday. So, Dr. Bharti, would you like to say something?
Hello. Yes, I think good afternoon and welcome to all the participants. So just wanted to know whether all the participants, they have downloaded Kahoot and they are comfortable while operating it. So anyone having difficulty, please let us know before we start. So, ma'am, can we have instructions to the participants or is it okay?
No, we've already given them, but I think it's okay to read them out again.
Okay.
Kahoot, I presume everybody has already downloaded.
I request here one Dr. Shikha. It's better she joins by her phone number because on the screen we are able to see that Shikha. So we don't want to have by the name. We want to have you people by their your phone number.
Absolutely. So the Kahoot pin is visible. Everybody is already joining. Yes. So 20 seconds will be given for each question, and we'll have a total of 40 questions. So it is your accuracy which matters, and the speed also matters, because somebody who gives the correct answer earlier than the others will get the first chance, the maximum score. So it's an automatic score which comes through the app, but then you have tried to be as fast as possible.
11 have already joined. That's right. So we are expecting 20 total, right, ma'am?
22 actually.
22 actually, okay.
We'll wait another 2 minutes. By 4:10.
Yes.
Whoever has joined.
11 have joined. Yes.
I think the remaining will also come in fast.
Cannot join. Dr. Shikha, she has dropped a message that she cannot join. So, Mr. Shivam, can you help her, please?
Ma'am, she needs to join with her mobile number. Actually, she had joined, but
she had joined by her name. By name, actually, name, but then later on she tried to.
Dr. Rupneet.
Yes.
So, ma'am, they can join again. Just enter their phone number as a nickname.
How do we know if Shikha has been able to join finally or not?
We just can, they can drop a message that they are able to join. That is the only way to know.
Okay.
So we just want a confirmation from Dr. Shikha. Even Dr. Rupneet, she previously joined by her name, but it's better they join by their phone number. So I think we are able to see now 15 participants till now.
Yeah. I don't see Shikha's number though.
Oh.
Shivam, do we give them the option of scanning the QR code if they're having a problem?
No, they can scan, but I think most of the participants are able to join. So link is okay. 16 participants are joined, no?
Okay, Shikha has joined. She has sent in a message that she has joined.
Although
Shikha and Rakhi. But I'm so glad they still wanted to join and they have joined. So only thing, they will not be eligible for the next round. So that is now 15. We had 16. What happened? Shivam, from your end, from the Conference International, how many people are there?
No, only one. I am only
You're the
there.
only one. Okay, so we see 22 on the Zoom. So maybe there are others who've just come to join and they are not participating through Kahoot, because there are 22 people, which includes, we should be having 19 people joining as per this. Unless there are some people who came to watch and who are not actually playing.
So should we wait more for 2 minutes or we can start?
I guess 2 more minutes. Hai na? So it is
2 more
11 minutes
okay.
past 4, and as soon as it's 2 minutes from
Okay.
now, 13 minutes past 4, I think we'll get started.
Okay, so 17 have already joined.
Somebody else. I guess people will quickly pack up and finish their work and come.
So 20 seconds will be for each question. There will be 4 options for each question, and the 20 seconds will be given for each question.
Yes.
So we have total of 40 questions. And after each question, the score will be displayed, right?
Right. So the other limb which comes through the quiz that is conducted by the center, so that they give certain topics, like it is topic centered. If it is andrology, or it is ovulation induction, or it is endometriosis, so then that quiz is more specific. We have questions from all different aspects of infertility. So that is also a very interesting one to watch, actually. So I think we can get started.
Yes. So Mr. Shivam, you can just share the screen and then we can proceed.
So ma'am, I am just locking the quiz now. We can start, right?
You can start.
Here
You
it
can
is.
just lock it
Here
and
it
then
is.
start.
So nobody else can join now.
So starting with the first question, which of the following is not a feature of cartilaginous syndrome, bronchiectasis, azoospermia, situs inversus, and sinusitis? So yes. 2 seconds more. Done. Okay. So 2278. Okay, moving to the second question. Which of the following statement is true about ovary? It's a retroperitoneal organ attached to the lateral pelvic wall by ovarian ligament, usually adherent to anterior surface of broad ligament. None of the above. You have 9 seconds remaining. Yeah, almost 20 seconds over. And we are done with 2 questions. Oh, so this is a scoreboard. Moving to the third question. Late onset OHSS is usually due to HCG trigger, excess dose of gonadotropins, conception in fresh IVF cycle, and none of the above. So half of the time is gone. Yes, we are done with 3 questions now.
So top scorer is...
Yeah, we can only see by the number. Going to the fourth question, peak secretion of progesterone is on day 1, day 7, day 14, or day 21. You have 13 seconds remaining for to attempt this question. 50% of the time is gone. Oh, the time is now over for this question. So 2706, number ending with 2706, right? So going to the fifth question, elagolix is oral GnRH agonist, oral GnRH antagonist, gonadotropin, or selective progesterone receptor modulator? Time is up for this question. So, looking at the scoreboard, and number ending with 2706 is on the top. Okay, moving to the sixth question. Surrogacy is an option for all except single father, single mother, MRKH, and intrauterine adhesions. So almost 50% of the time over. Okay.
2706 is
2706. So moving to the seventh question. As per Ashray, premature ovarian failure is characterized by all except oligomenorrhea or amenorrhea for at least 4 months. Elevated FSH level of more than 25 on 2 occasions 4 weeks apart. Age is less than 40 years. And last option is oligomenorrhea or amenorrhea for at least 6 months. Oh, this number is beating all. 2706. The cause of subfertility in endometriosis is due to all except distorted tubo-ovarian relation, dyspareunia, hostile peritoneal environment, or poor ovarian reserve. So 11 had attempted. True. Okay. Moving to the ninth question. ART is the first time treatment in all except bilateral tubal block, grade 4 endometriosis, non-obstructive azoospermia, and patient who needs PGT. So this is the ART is the first time treatment. So read it carefully and then attempt. Time is over for this question. Okay. So only one has attempted. Oh, this number is still on the top. So moving to the 10th question now. How long does an egg survive without fertilization? This is a basic question. 24 hours, 48 hours, 12 hours, or 4 hours? I think this is a very simple question which we read in our MBBS tenure also. Okay, so 12 have attempted. All right, okay. So now 7288 has taken the number 1 position. Moving to the 11th question. A right ovarian artery arises from aorta, common iliac, renal, and hypogastric. So this is a test of our basic anatomy, that right ovarian artery arises from which artery or which structure. Oh, so almost 10 participants, they have attempted correctly. So can we have a scoreboard? Okay, so now, and the number ended with 7288 is on the top. Moving to the 12th question, most fertile days for a woman. This is also a basic question. On the day of ovulation, 2 days after ovulation, 4 to 5 days before ovulation occurs, until the day of ovulation, or a week after ovulation. Oh, so 11 people, they have attempted. All right, and now the 7288, it is still holding its first position. So what are the chances of fertile couple conceiving in 1 month? A very simple question. 80%, 25%, 45%, or 60%? Okay, so 10 participants, they have attempted correctly. And the same number is still holding its first position. Moving to the 14th question, indication of letrozole. In all conditions except when the patient has a BMI of less than 30, clomiphene resistance, CC-induced thin endometrium, or infertility in known case of breast cancer. So letrozole is being used left and right. So just focus which one of the option given below is not correct. Okay, so 11 have attempted correctly. So looking at the scoreboard now, let us see. The same number still holds its position. Okay. Moving to the 15th question. The ideal choice of unexplained infertility, ZIFT, ICSI, IMSI, or IVF. The ideal choice of unexplained infertility. Almost finished with this. Okay. Oh, 7288. Still it's on the topmost position. Moving to the 16th question, contraceptive of choice in premature ovarian failure, progesterone only pill, estrogen, OCs does not require. Okay, so only 3 have. One more. Okay. Moving to the 17th question. All are adjuvant in infertility except metformin, HCG, myoinositol, melatonin. Okay. So 7288 it is still on its first position. Moving to the 18th question now. Regarding hormonal treatment for endometriosis associated pain, which of the following statement is incorrect? OCPs level A evidence, progesterone level A evidence, antiprogestrogens level A evidence, GnRH agonist level A evidence. So 4 have given a correct response. Okay. So moving to the 19th question. What is the function of Sertoli cells? They secrete testosterone, progesterone, aid in spermatogenesis, and seminal fluid secretion. So what is the contribution of Sertoli cells? Are they hormone secreting or they are just producing some? Okay, 12 participants, they have given a correct answer. So with this, we'll be finishing half of our questions. After how many days of ovulation does embryo implantation occur? 3 to 5 days, 7 to 9 days, 1 to 2 days, 11 to 13 days. So this is after how many days of ovulation? Post ovulation, how many days embryo implantation occur? 7 have given a correct answer. Moving to the 21st question now. During IVF in a 38-year-old woman with AMH of 2.1, only 6 oocytes are retrieved. So which Poseidon criteria we feel she falls into? Category 1A, Poseidon criteria 2A, 2B, or 4 category. No, 5 have given a correct answer. And looking at the scoreboard, the same number is still at its first position. Now moving to the 22nd question. Sperm donor selection criteria includes all except age of the donor must be between 18 to 30 years. Blood group, RH status, and thalassemia needs to be determined. Donor should be free of HIV or all other infections. Recording of height, weight, educational qualification is also to be done. Okay. So, moving to the 23rd question now. Actually, good practice recommendations for add-ons on in IVF 2023. Which one is correct? Embryo hatching, time-lapse imaging, addition of hyaluronic acid to embryo transfer medium, or endometrium receptivity array. Era.
Somebody else has taken over now.
Yeah, somebody has taken over now. So now knowing about post-coital test, this is negative, no spermatozoa are found in cervical mucus. Test is positive if no spermatozoa are found in cervical mucus. Test is negative if spermatozoa are found in vagina, or test is positive if spermatozoa are found in vagina. So how do you interpret this test? So only three test is negative if they, okay. So looking at the scoreboard after this, now 3261 is on the top. In azoospermia, fructose is absent in obstruction of retitestis and epididymis, ejaculatory duct obstruction, primary testicular failure, or hypogonadotropic hypogonadism. Thirteen have given a correct answer. Okay. So now 3261 still holds its position, and 7 to 8 it is moved on to the second position. So now attempting 26th question of today's quiz. Who got Nobel Prize for Physiology of or Medicine for Development of IVF in 2010? Robert G. Edwards, John Slee, Ruth Fowler, and Patrick Steptoe. Seven they have attempted correctly. Yes. So looking at the scoreboard, 3261 on the top. Louis Brown was born in, I think this is a very simple question, 1979, 78, 80, or 1977. Thirteen have attempted correctly. Okay, so 3261 still holds its first position. Regarding clomiphene citrate, all are true except ovulation rate ranges from 70 to 92%, anti-estrogenic effect on endometrium. It has estrogenic effect on cervical mucus or subclinical pregnancy loss. So this is also a simple question because clomiphene citrate is, I think, first ovulation induction drugs which is being discussed frequently. Okay, so 12 participants, they have given correct answer. And while looking at the scoreboard, 3261 is still on at the top. Now moving to the 29th question. Assisted hatching improves implantation and pregnancy rates in all of the following conditions except multiple IVF failure, chromosomal abnormalities, age is more than 38 years, embryos with poor prognosis. Assisted hatching improves implantation and pregnancy in all except. So 13 have attempted and 3261 still on the top. Moving to the 30th question of today's quiz. The chances of ectopic pregnancy after IVF are list with day 3 fresh ET, day 5 fresh ET, day 3 frozen ET, day 5 frozen ET. Okay, so 9 have given correct answer. And looking at the scoreboard, the same participant still holds its first position. Reading the 31st question, embryologically, the vas deferens and the body of epididymis are derived from what developmental structure? Are they from Mullerian or Wolffian or urogenital ridge or urogenital folds?14 have attempted in a correct way. Moving to the 32nd question, 30 seconds question. Which of the following is not a morphological parameter to assess embryo quality? Blastomere appearance, fragmentation, multinucleation, and centrosomal dysfunction. So, which morphological assessment is not as to grade the embryo quality? Maximum have given correct answer in this, and topper has decided not to go down from his first position, his or her first position. Diagnosis in a 16-year-old girl with primary amenorrhea and normal development of breasts and genitalia can be all except uterinogenesis, hyperprolactinemia, complete AIS, and Turner syndrome. So here patients have normal development of breasts and genitalia. Oh, maximum have attempted it correctly. And now if we look at the scoreboard, 3261 is still doing best. The treatment of virilizing adrenal hyperplasia is estrogens, anti-androgens, progesterones, or cortisone. So how we treat this virilizing adrenal hyperplasia? Maximum have attempted correctly. And yes, the scoreboard is showing 3261 at its first position. Now moving to 35th question. During IVF, the cutoff used to define elevated progesterone levels on the day of trigger is 1.2 nanogram, 0.5 nanogram, 2.5 or 3 nanogram. In IVF practice, I think all of us doing this value and analyzing it routinely. So now 5 questions left. Reading 36th question. Meiosis is completed at onset of LH surge, ovulation, after extrusion of first polar body, or is it after fertilization? Oh, maximum have attempted in a correct way. Okay. So hyperprolactinemia cause infertility by always except atresia of dominant follicle. It induces uterine adenomyosis, reduces testosterone synthesis, or increases 5-alpha reductase activity. So only 5 have given a correct answer. A little difficult question. Okay. So I think now we feel that almost three questions are left. All are adjuvants used to prevent post-operative adhesions except Intercede, Ceprafilm, Ispon, and Lanolin. Six participants, they have given correct answer. Okay. So second last question of today's quiz. All are features of AIS except X-linked recessive, male pseudohermaphrodite, presence of testes, excess facial hair growth. So these two questions can be a game changer. So 12 have attempted correctly. And okay. So now moving to the final question. Fortieth or deciding question of today's topper, for today's topper. All are advantages of TISA except good yield, especially in NOA. No microsurgical skill required, can be done under local anesthesia, or can be used for obstructive or non-obstructive azoospermia. So 7 people have attempted it correctly. Okay, so after that, the final score vote displaying our first, second, and third topper. Okay. Okay. So is the first number? So 3, the number ending with, I think, 34 and, so okay, 35 out of 40. First, second, and third. So, hello. Hello, ma'am. Please, Mr. Shivam, please unmute Dr. Loveleen.
You can unmute.
Yeah, for some reason I got disconnected and I had to log in again. So that was on the last question. So we have the winners now lined up, and I think we would like to ask them to identify themselves. Hello.
Hello. So, Mr.
Hi.
Shivam, hello.
Mr.
Yes,
Shivam,
ma'am.
please name the phone numbers. Recite the phone numbers.
Ma'am, I'll share the phone numbers with you after the meeting, right?
Okay.
Oh,
Yeah.
can't we do it now so that we can, those people can identify themselves and everybody will know they are the winners?
Okay.
Here
Okay.
it is, ma'am.
So,
Here it is.
So, Mr. Shivam, just wanted a correction. You look at
781488.
6148. Here we have written 35 out of 40, but we are saying that she is third. And
So
3261,
that is
34 out of 40.
yeah, that is actually the accuracy and time is also matter, ma'am.
Okay.
Yeah.
Okay, so we need to clarify this to the participants, because here at looking at one glance, we just feel that she's the one who has attempted the maximum questions correctly. But yes, it is the time which also matters. So looking at all these factors, I think the number ending with 3261 is at the topmost position, right?
So, will you identify yourself?
The number 7814883261.
Hi, Dr. Ravi.
Yeah.
First number is mine. I'm first, Dr. Raki. I'm
Oh,
within
okay.
46 years category. And the third number is Dr. Vani's the third position. She's under
Okay.
Okay.
45.
So, and what about 27288?
Who is 27288? Please drop a message.
800-982-7288.
Yes.
So if this person should be the one. How come this person has disappeared after playing so well?
Oh, even I'm trying to identify, but 27.
And you
Okay,
can
then
call
yes,
and ask us after the
हाँ,
meeting.
Yes,
we will
yes.
do that, है ना? And
Mm.
in the meantime, Vani is the person who is the at the second position, excluding Dr. Rakhi. So she should be going to the zonal round. And then, of course, we have one unidentified person who is to go to the final round. Congratulations, Dr. Vani. Shivam, can you unmute for everyone for a few minutes?
Ma'am, they can
Just
unmute.
before we close?
Yeah, they can unmute.
So at least we would like to say congratulations to Dr. Vani and Dr. Rakhi Goyal. I'm sure Rakhi has been mentoring her also.
Hi, ma'am. Vani has come into my mind. Camera on करके.
Hello, good evening, ma'am. I just
Good
got.
evening. So congratulations, Vani, and
Thank you,
congratulations to you also, Rakhi. And so we let you know when the zonal round is going to be done, and everybody should be getting a certificate of participation, and the winners, of course, will get a winning certificate as well. And I will inform in the groups as to who is the other person who's going to the zonal round. So thank you so much for joining us. I think it was interesting. We try to keep it simple so that a lot of people could get good answers. But then, yes, there were some difficult questions. Well attempted, well done. With this, I would like to say thank you, and over to Dr. Bharti for her comments.
Thank you, everyone. I think all of you have attempted it very nicely. Yes, they were the basic questions, but some definitely were on the higher level. Definitely, we needed to put them because otherwise, there will be a difficult to differentiate between toppers and the ones. Otherwise, all of you are at the same level, so that is not the issue. So all of you have attempted very well. So best wishes to the winners for the next zonal competition. And let's hope that our Chandigarh chapter's representatives, they score good in zonal as well as at the national level also.
Absolutely.
So with this, I think we can end this quiz if
Yeah.
Madam permits.
Absolutely. Thank you so much, Dr. Bharti, for being such a great help.
Thank you, ma'am. Thank you. You always
And
there
thank you
for
so
us.
much, Shivam, for standing by us all through.
Pleasure, ma'am.
Thank you to all the
Thank you, Mr.
participants.
Shivam. Yes. Thank you all.
And bye-bye.
Bye.
Bye, ma'am.